We are now recording.
Thank you. Are we ready?
I think we're ready.
Hey.
Hello and welcome, everybody. I'm Janaea, Providence Public Library's Events and Programs Manager, and welcome to the Providence Public Library Conservator Society presents The State of the Pandemic in Rhode Island, a virtual public conversation with Dr. Philip Chan and Dr. James McDonald. We at the Providence Public Library are honored to co-present this event with the Providence Public Library Conservators, the most fervent supporters of the library. Their generous annual contributions sustain the institution as a vital resource for learning, enrichment, and achievement, always free and open to all. Providence Public Library provides free public library services through its rich and historic physical and digital collections, extensive information sources, thought-provoking exhibitions, impactful educational programs, and expert staff. Since its founding in 1875, Providence Public Library has been a resource to our diverse city's many dynamic immigrant communities, offering books, periodicals, media, and a wide range of educational opportunities in a variety of languages, as well to the city's thriving art and design communities, regularly hosting artists and art students doing research and serving as the public repository for archives of a growing number of many community arts organizations. Tonight, we are in webinar format. Please feel free to ask questions via the chat or the Q&A option. And I will be making sure that Dr. McDonald and Dr. Chan are able to get to everybody's questions, or as many as they can tonight. They will talk for about half an hour, and then we'll have 10 to 15 minutes of questions and answers. Also, please note that we do have Spanish language interpretation and closed captions. For the Spanish language interpretation, thank you, Hector, for being here tonight from Be More Interpreters. You just need to press the interpreter symbol. That's that circle with the globe shape. And to use or turn off the closed captions, you can press the CC button and it should get you a set of options. If you have any technical difficulties, feel free to message me in the chat. All right, as a follow-up, tomorrow you will all receive an evaluation form by email. Please fill out this form. Our ability to evaluate our programming helps to improve our offerings, and it's crucial to our fundraising efforts. Now, to introduce our esteemed speakers this evening, I will turn things over to Maya Farish and Adriana Dawson, PPL trustees and Conservator Society co-chairs. Hello and thank you.
Thank you. Thank you, Janaea. Oh, there we are. Hi. Okay, I have never done this before on a Zoom. Had the privilege to sort of help convene a program. So it's just great to be here with our supporters, our conservators, who help the library do what it does. And as Janaea said, Adriana and I are members of the PPL Board of Trustees. And I'm proud to own up to the fact that I was asked if I would help recruit Adriana to the PPL board. And I was delighted to do so because Adriana and I go back a number of years. Adriana worked in community engagement at Roger Williams University. And that's where I met her, and she and I clicked right away. And this is sort of full circle because here we are again doing community engagement. And it just feels like the conservators and all of you here really help PPL to fulfill our mission every single day. And I just want to thank you, and I want to turn it over to Adriana to introduce herself, and we will begin introducing our guest speakers. Thank you, everybody.
Great. Thank you, Maya. And good evening, everyone. It's an absolute pleasure to be here with all of you today in my first official capacity with my good friend Maya as the co-chair of the of this tremendous society. And I just want to underscore and recognize the Conservator Society as a group of PPL's most loyal and generous donors who sponsor programs connected to our collections, and in doing so allow us to delve even deeper into social, environmental, cultural, and economic issues of our time, particularly when we know, and it's PPL's stated vision, that all Rhode Islanders should be engaged, informed, enriched, and they should continue to thrive. And so thank you for the opportunity to join all of you this evening. And it is in that spirit that we're here tonight with our two distinguished guests to make sure that our community and society continues to thrive. So with that, if you'll allow me to introduce Dr. Philip A. Chan, who is an associate professor in the Department of Medicine and School of Public Health at Brown University, an infectious diseases physician. Dr. Chan also serves as an infectious diseases expert and consultant, medical director for the Rhode Island Department of Health Division of Preparedness, Response, Infectious Disease, and EMS. He has been involved in the COVID-19 response since the beginning. In his other work, Dr. Chan also serves as Chief Medical Officer at Open Door Health, the state's only community-based LGBTQ+ clinic. Please join me in a virtual round of applause for Dr. Chan, and I will turn it over to Maya to introduce our next distinguished guest.
Thanks, Adriana, and hello, Dr. McDonald. I have always welcomed your reassuring presence at press conferences and briefings throughout this pandemic. Dr. McDonald has been with the Rhode Island Department of Health since 2012 as Chief Administrative Officer of the Board of Medical Licensure and Discipline. And he's also been the medical director of the COVID unit, as well as the Customer Services and Drug Overdose Prevention Program. Very important resources. I'm going to let Dr. McDonald go into more granular detail of his background, but I want to call attention, especially for our esteemed veterinarian here in our midst, that he has two dogs named Rosebud and Daisy, not to take away from the fact that this is a cat vet we have in our presence. So anyway, I loved his bio because it really speaks to Dr. McDonald's accessibility to the public and his love for his profession and his family and his community. So it's great to have you both here, and enjoy the program. Thank you.
Wonderful. Well, thank you very much and good evening. I just want to make sure everyone can hear me okay. Thumbs up, couple thumbs up. Beautiful. So first off, I just want to welcome everyone tonight and say hello from the Rhode Island Department of Health, Director Alexander Scott, and the rest of the team. You know, that's been one bright spot about the pandemic, is the way that all the organizations across the state have really come together. I mean, Dr. McDonald, you can comment on this too, but it's really been amazing, really the teamwork across the entire state. And I just want to recognize certainly the literally hundreds and hundreds of people at the Department of Health, in public health across the state, that have really been working on this since day one. And it really has been nice to see folks from across the state, across public health, clinical organizations, non-clinical organizations, community-based organizations, Providence Public Library holding community forums. I mean, I feel like everyone in the state has really stepped up to try to do their part to address the pandemic. And that's been really reassuring. And of course, getting to know some of the fantastic people even more closely at the Department of Health, Dr. McDonald included. Make sure to check out our podcast. If you haven't heard it, we have a weekly podcast. Everyone's invited. And I think something that just Maya mentioned a second ago about accessibility. And that's been one thing that we've tried to do at the Department of Health. And we try to do it to the best that we can. Of course, none of us are perfect. We're always trying to get better. but we have tried to be accessible, both as physicians in terms of disseminating the data and the science. I think that's one thing that all of us have seen during this pandemic is such the rapidly evolving nature of the science, of the data, of the information. It's been information overload. I think if you're a media person, you've loved it because there's a hot topic every day of the week, every day of the hour, potentially. So it's been absolutely crazy with all the incoming information. And I think one thing that we've tried to do is be accessible both to the public, to other physicians, clinical organizations, to try to synthesize, interpret the data and go from there. I want to make a couple comments about the pandemic, but I think lessons learned and where we're going. I don't want to talk that long. I want to make sure to get to all the excellent questions that we've received. But I do want to say before we get started, just related to books, obviously sponsored today by Providence Public Library, but I love books. And I just wanted to, the team at PPL knows this, but in previous meetings, it had talked about my love for books. And I actually collect science fiction and fantasy books. And so things like games, Game of Thrones, Altered Carbon, if that rings a bell, but books like that are really my go-to books. So one of my leisure activities is visiting bookstores, actually, and used bookstores especially. And it drives my wife nuts, to be honest, but I don't apologize for it. I love books, and I still read about a novel a month. So feel free to recommend things to me. I feel like I do need to read, science fiction, fantasy to escape from the craziness we call the pandemic. So feel free to recommend away. Always looking for new recommendations. But to talk a little bit, just for the next few minutes, about some experiences, lessons learned about the pandemic, and then we'll get into some questions here. Just as an infectious disease physician for over a decade here, I have to tell you that what we're experiencing is really been unexpected. And the word unprecedented has been used. I think it's been used, far overused, but it's true. None of us expected a pandemic of this severity, given this modern age of medicine. And I think the last pandemic that we've seen to this scale, right, was the 1918 flu pandemic. And by the way, we've already surpassed the number of deaths in the US seen during that pandemic. And I guess a lot of us thought, and I'll speak for myself, I thought that we would never see a pandemic of this magnitude because of, frankly, antibiotics. And what you've seen with past pandemics is that a lot of people died because they got what we call secondary on top of bacterial pneumonia. And of course, we can treat bacteria with antibiotics. So a lot of us, I think, were surprised at the aggressiveness of the virus, of SARS-CoV-2, the cause of COVID-19. And I think all of us were frankly taken aback. And frankly, I think the entire world was really unprepared. I think some lessons learned, and I'd be curious, if we're in a live audience, I would ask people to raise their hand, but do people remember the first case in Rhode Island? Dr. McDonald used to always, or has always cited to us, at least internally, the number of days we were from the very first case. And, the very first case, I'm reminded, was actually some folks who had traveled from Italy. And I think in retrospect, one thing that we as a world, as a country, need to be cognizant about is how to react when there's outbreaks to this magnitude. And to me, early in the beginning, when you diagnose a case, whether it be of COVID or another infectious disease, it's already too late, meaning a lot of times it's already spread beyond borders, et cetera. And I think we saw that with the pandemic early on, is that they were starting to diagnose a case or two in Europe. At that point in time, we were already a couple weeks behind, and sure enough, Americans, other people, travelers were already infected and traveling back to the United States. So I think lessons learned just about being more aggressive when there are some of these new viruses that we don't know a lot about, being more restrictive in the beginning. And I'm also going to, some of the other things I've learned during this pandemic, and Dr. McDonald has some great quotes. Sorry, Dr. McDonald. Hopefully I'm not stealing any of your thunder. But some of the quotes that you love to remind us all, the Department of Health, are that we've been building the plane while flying and going to war with the army we have. And I think especially in the early phases of the pandemic, and even now, right, for certain things, is that we've always been hamstrung by the lack of numerous things. So in the beginning, it was personal protective equipment, masks, N95s. We were reusing masks. We couldn't find a test. We had to prioritize testing. We didn't have a test available. We didn't have vaccines for the longest time. So, you know, we've been really hamstrung since the beginning. And it's been nice to be part of at least of a state which has had a generally coordinated response to a lot of these challenges, and they've been challenges, but I'm glad to be part of the team that has worked to addressing these problems. Everything considered, I think we've done the best we can here in the state of Rhode Island. And one of the big lessons to me, and this has overlap, I think, with many other parts of American life, culture, et cetera. But to me, the pandemic has also highlighted why we need to focus on data and science and evidence. And I think, to me, personally speaking, one of the things that I'm worried most about in this country, forget COVID for a second, forget all the other problems that we have, is just this focus and this proliferation of misinformation and myths. And we've seen it in the political space. We've seen it in COVID. And the problem is that if you don't have a society, a culture that rely on data and facts and science, what do you rely on? Because then you all become an expert in, well, whatever it is you want to be. And everything disintegrates. And I'm not saying that we all have the same answer, right? The fact of science is that it evolves, it changes, the data changes. And so to me, if you look at early on in the pandemic, things like hydroxychloroquine, if you look at some of what's happening now with ivermectin, I mean, these are unproven, not only not proven, they've been proven to not work in multiple studies. And so just on a side note related to the pandemic, I really, really do think that we as a society and a culture really need to start to focus and really highlight and put on a pedestal the need to look at evidence-based approaches, whether or not it be for COVID, the pandemic, school systems, how to teach kids, whatever you want to call it, masking, et cetera. So we really need to follow the science and the data. We really need to try to achieve truth at the end of the day, and working towards it with the humility and also the understanding that none of us have the right answers. Sometimes we have to compromise. I think the pandemic has been a fantastic example of that. And hopefully we learn our lessons from that. The final thing I just want to briefly touch on is vaccinations. Where do we go from here? You know, both Dr. McDonald and I see patients currently. In fact, that's why I was a little bit late to the pre-call here. But you know, even today, I had 2 patients, younger folks, that were really vaccine hesitant that I spent 30 minutes talking to trying to convince to be vaccinated, and addressing, again, all these sources of misinformation and myths. So hopefully we'll get into that a little bit with the questions. I do think moving where we're going from here is that vaccination is key. We need to really focus on getting vaccinated. We need to focus on the science, on the data, and that will help guide us out of this pandemic. I really, really, really do believe that. I do believe we have all the tools in our toolkit to really clamp down on this pandemic and really end it. There's certainly been a lot of curveballs, but if we do follow the science, I do feel like we will get out of this. And finally, before I hand it over to Dr. McDonald, I just want to acknowledge for those on this call is that the pandemic period has really been a challenging time, frankly, for everyone. Rhode Islanders, you know, healthcare folks, people in the community, people have lost their job, food insecurity, housing is, you know, a major challenge here in the state. So just want to acknowledge the suffering, certainly, that many people have experienced, mental health through the roof, substance use. Dr. McDonald is taking a lead on in the state here. But I do feel like we're all in this together. And I just want to let you all know that myself, Dr. McDonald, all of us at the health department stand with you. We are trying to do our best. It has been a long road. I do see the light at the end of the tunnel, and we are all getting through this together. So thank you very much. I'm going to hand it over to Dr. McDonald and look forward to answering some of your questions in a few minutes. Thank you.
Thank you, Dr. Chan. I'm just going to take it over from there, if you don't mind. In the chat, I'm going to put
Dr. McDonald, you're muted. 1 second.
Oh, I'm unmuted now.
There we
Thank
go.
you. Gosh, not the first time that's happened to me today. Thank you so much. So this is one of the things about Zoom that's so interesting is I'm so used to it. I'm too used to it. But thank you, Dr. Chan. And what I did is I put in the chat 5 questions I'm going to try to answer over the next few minutes to give you a sense of, a little overview of where we are tonight. But the first question I'm going to start with is what happened? And I think it's important just to have this context about what happened, because 613 days ago, we saw patient number 1 in Rhode Island. And it's interesting, on that Friday night when Dr. Klein called me on the phone and said, hey, you want to come to the Department of Health tomorrow? A bunch of us are getting together. We have our first patient that has COVID. We thought we'd see if we could help out a little bit. So at 8:30, when I'm pulling into the Department of Health on February 29th, 2020, I was called my wife, Gail, and said, I don't know if I'll be here an hour or a little bit longer. I'm not really sure what's going on, but I'll give you a ring and let you know what's going on. So that night when I pulled into my garage at 10 o'clock at night, I was a little surprised how long a day it was. And I, really think what happened is this. One of the things that happened is, as a species, I think it's just really important to get this concept across. As a species, we were all exposed to a novel infectious agent. I know that sounds obvious, but it's really important to grab this concept is, as a species, we all had the same threat. We didn't have the same risk, but we had the same threat. And one of the things that occurred is, as a planet, we decided we would address the threat. In the beginning, similar, right? And over time, different parts of our country in particular approach the common threat differently. And one of the things I just want to underscore is that when you really get down to it, since the whole planet was exposed to a common threat, it really started what has been a major population trauma. And I think it's just important to look at the pandemic as that way. Like, there's a lot of emotion during the pandemic. A fair amount of emotion gets exchanged every day for a whole lot of reasons. But if you need to have one way to just explain it, we've been through a population trauma that we're still going through together. So the whole planet is going through this trauma. It's worse in certain parts of the world, like Africa, where vaccine is still in the low single digits. And there's sort of this weirdness going on in the United States right now that's kind of hard to describe. But I'm going to get into that in just a minute. But I want to just underscore where we've been. Because last year at this time, as we were just finishing Halloween, there was no vaccine. There was no monoclonal antibody. Our cases were going up. Our hospital system was in jeopardy. We had a great deal of concern about what our future was. We were living during a time of phenomenal stress and phenomenal pain. Loved ones are passing away, very much so in nursing homes, and other loved ones are passing away right before our very eyes. And as a planet and as a country and a state, there was this great sense of like powerlessness. But at the time last year, there was this slight ray of hope that clinical trials are going on a vaccine. And at that time, we were starting to hear that things were going well with the vaccine. We didn't know for sure, but we were hearing positive things with multiple vaccines in the. So that's where we've been, quite frankly. And where we've been, though, is very intriguing, because one of the things I think you saw is just the explosion of science. Like, for every kid who's been in school and says, why do I need to know this? That was answered in 2020 and 2021, because someday you're going to be the scientist that discovers the vaccine or the monoclonal antibody or the testing reagents, and you just fill in the blank about what came out of the pandemic. Someday you're going to be the kid who invents Zoom. Someday you're going to be the kid that changes the world. And one of the things I think you really see is that science technology exploded. And in many ways, it's really been what saved us from this horrible pandemic. It's kind of interesting, though, because what I think has saved us from the pandemic, in the view of others, has become a bit of the pariah. And it's interesting, like in the pre-chat, Dr. Hittner asked a question, like, what was the most frustrating thing? And I said to Dr. Hittner, we don't use the word frustration in the Department of Health, or any word that starts with dis. Like, we don't say we're disappointed, discouraged, or disheartened. We just don't do those things, because it's not how the Department of Health rolls. But one of the things that we have to acknowledge is, wow, where we've been has been a really interesting journey about organized disinformation and really this infodemic. And infodemic is a new word to me. I learned it yesterday. I've used it several times already. My daughter's a communications major at Gordon, and she was studying at infodemics, which is really this widespread information or widespread transmission of false information. And this is one of those things that's not new in our culture, but it's exploded in our culture. The third question I want to answer tonight is, why are we still here? Because here's the thing. We had actually had conversation at the Rhode Island Department of Health that we could see the end of the pandemic by Memorial Day. In other words, we had this 90-day plan that we kept private, but we really thought with vaccine rollout, we could see the end of the pandemic by Memorial Day. And we really could see it. The problem we had was Delta, and Delta COVID changed everything. Quite frankly, we were at the lowest we were in transmission around 4th of July. And around 4th of July, we saw actually 9.9 cases per 100,000 per week. We were pretty happy at that point. We could see the end of the pandemic then, but that's when Delta COVID took over. And right after 4th of July, Rhode Island became overwhelmed by Delta. Delta is still 100% of our COVID right now. We have a little bit of some Delta Plus and some of the other Delta variants, but right now it's Delta that's driving our. We're still here because one, Delta COVID took over, and we quite frankly didn't vaccinate enough people. Good for us that even though Delta, which was a variant of concern, was not a variant of high consequence, and good for us we had vaccine that would actually contain it. What's a bummer for us is I can say with a straight face, there's probably 200 people who have died who didn't need to die because we just quite frankly didn't immunize enough people. It's not a statement of derision or a statement of judgment. It's just one of those things that it's like, that's a public health adverse outcome that could have been prevented. And if we don't stop it, acknowledge some of these things, we won't learn from it. You know that old expression, if you don't learn from history, you're doomed to repeat it. One of the concepts that weighs heavy on my heart is we really could have solved this pandemic sooner. We just didn't get enough people vaccinated. Next question I want to answer, though, is what is next? So what is next is, I actually think I can see the end of the pandemic again. And that's a bold thing to say on a Tuesday night. But I really think if we get about 90,000 more people vaccinated and the vaccines stay good and we don't get a new variant, we probably are going to be able to see the end of the pandemic. And it might be early 2022 that we see that. And one of the things I sense that that's possible is because we are still seeing really good uptake. Now, one of the things I'll say about prognosticating anything about the pandemic is you got to be careful about that. In the last week, our cases are ticking in the wrong direction. You know, that, as I've talked to our statisticians about, wasn't completely surprising, but it's something I look at very carefully. You know, when I see our cases gradually ticking up again, it makes me pause, makes me nervous, but I still think as we see more vaccination come out, we're going to be in better shape. The big news we're waiting for is the 5 to 11-year-olds. And as of, today or tomorrow, we should see the 5 to 11-year-olds come forward and be able to get the vaccine. There's about 80,000 5 to 11-year-olds in Rhode Island. We're hoping we can get as many of them vaccinated as possible. That is one of the big things we need to do, is vaccinate as many 5 to 11-year-olds as possible. The next big thing we need to do to overcome the pandemic is vaccinate the people who need boosters. There's about 300,000 plus people in Rhode Island who need to have a booster vaccine. That group is run into 4 categories: the 65 and older crowd, the 18 to 64 crowd with comorbidities. Then there's those people who live in residential settings, correctional settings, nursing homes. And then there's those people who have occupational exposure. Those are the 4 people who need a booster dose. In case you're curious, I got my booster vaccine Saturday morning, was a little bit achy Saturday and Sunday morning, and otherwise felt fine after some Tylenol. Last question I want to answer before we go to questions from you is, what is a syndemic? And my friends, I really want to close with this concept. We're in a syndemic. A syndemic is when multiple epidemics interact with each other. So we don't have just the pandemic. We have an overdose epidemic going on at the same time. We also have a behavioral health crisis in this country. Oh, by the way, George Floyd died Memorial Day, and that really just highlighted the structural racism, systemic racism problem our country has, which is really part of this syndemic we're in. And on top of that, like I mentioned before, we're in an infodemic where a lot of information that's being spread out now is just quite frankly false. And, to Dr. Hittner's point earlier, I spend far too much of my time debating with people, convincing people who quite frankly don't want to be persuaded. And one of the things that's, I think, the most challenging is dealing with people who have chosen to have fixed false beliefs and are no longer persuadable, which is a sad place to be. Like, one of the things I've just said about my own self during the pandemic is always have an open mind. One of the things I've said to my team repeatedly when it comes to the overdose epidemic, which got much worse during the pandemic, was I asked my team to suspend belief on what we knew to be working because we were failing as far as the overdose epidemic goes, and be open to new ideas. And in some degree, that's how the harm reduction center legislation got that more momentum and moved forward. With that, let me stop and answer questions. Thank you. So I'm happy to answer questions. I think someone's going to ask those of us. Is that right, Janaya?
Hello, sorry. I'm here. Some technical difficulties here. All right. Hello. All right. We have many questions for you too. And more coming in the chat, as I can see. I think one of the main questions we've had is categories in there. First, we have somebody who asked, I just received my third Pfizer shot from CVS, and I noticed that with every shot, my reactions got worse. I'm concerned that if side effects keep escalating, it could become dangerous to continue getting boosters. Also, when I received my first 2 shots, there at Women in Brigham Hospital, there was a follow-up questionnaire to track side effects. However, with the CVS booster, there was no follow-up to track side effects. How can we get accurate information on side effects if they are not being tracked? This is very concerning, especially since my side effects were worse after my 3rd shot.
So I can tackle this one. I think Dr. McDonald and I were probably just going to alternate questions so we can make sure to answer them all. So I'm sorry to hear about the boosters and the side effects here. I will say we do know that with at least the 2nd dose of the mRNA vaccines is that we do occasionally see worse side effects. The CDC did publish on the boosters, some early data on the boosters, which suggested that people who had a 3rd shot of Pfizer, for example, experienced the same sorts of side effects. And I think what I'm reminded is that everyone reacts a little bit differently to these vaccines, to medications, to everything. I would say that there's no data or science to date to support people having significantly adverse reactions to booster shots, other than what the typical adverse events that they have with the first and the 2nd shot, meaning sore arm, feeling a little bit general malaise, potential low-grade fevers, chills. So there is some data behind this. It shows that, again, that people tend to experience what they had the 1st or 2nd time. But, the boosters are also fairly new, right? I mean, they've just been authorized by the FDA in the last month here. So I think we're still learning, but based on our experience on the ground, what we're hearing from other states, and what the data that we've seen from the CDC, there's no reason to think that the booster shots, and what's also biologically plausible, like as we look at what's happened in the past and what we know, there's no reason to think that the booster shots should lead to any other more adverse or significant side effects than the first 2. Thank you for the question.
Thank you, Dr. Chan. And then the next booster related question, will the booster shot for the previous Moderna vaccinations, and I guess in general, all of the vaccines, be as potent or more diluted as the previous 2? How long might it
Janaya, I have the question in front of me. If you don't mind, I'll just answer it. Your audio's cutting out.
COVID?
Yeah, so Janaya, let me just answer that real quick here. I have the written copy of the question here, so I'll just go ahead and tackle it. Your audio was just a little bit garbled. So, one thing to think about is with the Moderna vaccine, and I'll make a distinguishing. There's a difference between a booster dose and a dose for someone who's immunocompromised. Someone who's immunocompromised gets a third dose. That's not a booster dose, that's a third dose. So if you have a moderate or severe compromised immune system, you should know who you are. Your doctor should have told you, you should get a third dose. If you're one of the 300,000+ people who fall into a booster dose and you get a Moderna vaccine, your dose is 0.25 milliliters. In other words, half the dose. If you're someone who's getting a Pfizer dose, it's the same dose. Having said that, I don't know how long it's going to last. I don't think anyone knows how long it's going to last. That's the whole point about boosters. We don't really know. Part of the reason I don't know is because we don't know if there'll be a new variant coming. And since we don't know if there's a new variant coming, we can't really say how long it's going to last. So thank you. And then Janaya, do you want to do the next question or do you want me to read it out loud? I know your audio was fine, but I just wanted to, your audio was a little challenging.
Maybe I should go to another room. So I'll move. Would you mind asking the next question?
Yeah, let me just ask the next question of Dr. Chan. My question is whether having COVID gives us good or better immunity than the vaccine. So Dr. Chan, that's a natural immunity question. What are your thoughts on that?
Yeah, so this is something that comes up a lot. So the fact of the matter is that yes, COVID does lead to some natural immunity. But what the data is really showing is that the vaccines provide better immunity and better long-lasting immunity. And the data is starting to accumulate on this. And so while having natural infection does give you some immunity, it's not as good as vaccines. And I think, one thing that I hear about too, just on a quick tangent is, why, isn't it better to let this infection infect us and we can get some natural immunity? And, this is what our immune systems are for. And I guess just reminding people, right, that we humans, medicine, spend a whole lot of our lives trying to prevent different infections from getting different infections, whether it be meningitis or severe pneumonia or even chickenpox, right, or measles. So again, this COVID is serious, and vaccination is key to preventing.
Thank you, Dr. Chan. The next question we're going to tackle is this one right here, which says, is it bad if you don't get any side effects? So it's funny you asked this question. My wife talked to me about this last night, kind of implying if you get the vaccine, you don't get an immune response, is that bad? And the answer is no, it's not bad. It just means you got lucky. So what I mean by that is it's not a side effect from the vaccine, it's an immune response. So when you get a vaccine, your immune system takes note of it. It releases all kinds of fun little things. You might get a fever, you might get a sore arm. It's inflammation. It's part of your immune system responding, but you don't have to have that. So quite frankly, I'd celebrate your good fortune and not worry too much about it. It doesn't mean you didn't have a good response. The next question is, what does the science say about vaccination risk for pregnant women and women who may become pregnant? Dr. Chan, why don't we let you tackle that one?
Yeah, so I think the first point is that COVID during pregnancy can be pretty severe. So I can't underestimate that. We've been on calls with Dr. Hardy, who's my go-to person in the top infectious disease person in the state in terms of pregnancy, and she sees us day in and day out is pregnant women who have bad outcomes when they have COVID, and so that just really highlights the importance, I think, of being vaccinated, even if you're pregnant. And the data at this point, again, reminding folks that these vaccines now, the first people got shots in July of 2020. So it's been a year and a half now that we've seen that people have had, that we have follow-up data on this, and there's vaccine registries, and the CDC has strongly recommended that pregnant individuals be vaccinated. And again, I think the data is there that the vaccine is effective and safe during pregnancy. In fact, I was just reviewing some data about spontaneous abortions and in pregnant women who got vaccinated, and showing that there's no, that there's really no increased risk. So I had a number of colleagues, healthcare colleagues, who were pregnant and vaccinated. I'm fairly convinced that it's safe during pregnancy, and we have now experience to show it.
Thank you. The next question I have here is about how many preteen children have died in Rhode Island as a direct result of COVID. And so there's been 3 pediatric deaths associated with COVID. In other words, met the CDC definition of died with a COVID test. None of those have died from COVID, they've died with COVID. When you look at the national data, I'm looking at the CDC webpage right now. In the 0 to 4-year-old age group, nationally, there's 202 deaths in the 0 to 4 age group, and there's 455 in the 5 to 18-year-old age group. So that's not exactly preteen, but I'm just giving you the CDC data. If you add that number 202 and 455, you get close to 657 that are COVID-defined deaths, according to the CDC. The next question, and I'm going to give this one to Dr. Chan, is what are the stats on hospitalization between vaccinated and unvaccinated? Dr. Chan, you would know the answer to that. What's on your mind with that one?
Yeah, so I don't know the exact numbers off the top of my head, but I have seen them, and it's pretty clear that people who are unvaccinated are hospitalized at much higher rates than those that are vaccinated. If you look at one thing that sometimes the data is skewed as or is twisted, right? If we have 90% of people in Rhode Island vaccinated, so and that's true for adults, that we expect that there's going to be more, that we may see a little bit of an equal percentage, say, of people who are vaccinated versus unvaccinated in the hospital. But again, given that 90% of people who are vaccinated are in Rhode Island, is that sometimes you have to make sure to compare apples to oranges. Meaning, if we had 100% of people vaccinated in Rhode Island, right, is that we would expect, only people who were vaccinated to be hospitalized. So the fact we have such a high number of vaccinated is that we do expect a number of vaccinated people to be hospitalized. It doesn't mean the vaccine isn't working, it just means that our vaccine coverage has been so high. And even that, given that, we're still seeing mostly unvaccinated people end up in the hospital. So based on the data of the science and even our experiences in Rhode Island, the vaccine clearly protects people from being hospitalized.
Thank you, Dr. Chan. I see about 10 more questions, so we're going to start going into lightning round here. Regarding vaccine hesitancy for kids, public schools, camps, colleges, and other activities for children and young adults have for decades required vaccines for childhood diseases. Why aren't COVID vaccine advocates at both the federal and state level reinforcing this fact? I think we are reinforcing this fact. I think part of what you're not going to hear right now is any conversation about mandating vaccines for kids, because one, the vaccine's so new, and two, I think we're waiting for FDA approval. And then the next question I'm going to give to you, Dr. Chan, is will future boosters be reformulated to address new coronavirus variants? Dr. Chan, what are your thoughts on that?
The answer is yes, they're being reformulated as we speak. And I'm just reassured that these mRNA vaccines can be easily made, again, to adjust and target new strains.
Next question is, now that messenger RNA technology has been validated, can we expect other viral vaccines along this line in the future? Yes, you can. And I think you're going to see messenger RNA technology for all kinds of treatment. Just to remind people what messenger RNA technology means is when I got a shot in my arm for my COVID vaccine, the skeletal muscle cells in my arm absorb the vaccine. In the cytoplasm, the messenger RNA is simply like a little construction team that goes and pretty much told them to make a protein and made the protein of the spike protein. That spike protein was presented on the outside of my skeletal muscle cells. My immune system recognized it, and then it made some antibodies. So if I get exposed to COVID, which might, because I'm a physician seeing patients, then my immune system is ready to take care of it right away. The next question is, what should parents of kids 5 to 11 be thinking about right now with news regarding eligibility for their kids? What do you think you advise to those who are hesitant and fear long-term side effects? Dr. Chan, what are your thoughts on that one?
Yeah, so I'm be curious to get your opinion on this too, Dr. McDonald, given that you're a pediatrician. But personally, I have a 10-year-old and a 14-year-old. My 14-year-old has been vaccinated. My 10-year-old is excited to get vaccinated. I'm reassured. I've looked at the data myself in the studies of a few thousand kids now. There's been no adverse side effects. And I'm also reassured because for under 12, which should hopefully actually be recommended this week, is that it's a third a dose of the Pfizer. And in the 3,000 kids who've been vaccinated, there's been no cases of myocarditis, really no adverse events at all. So I'm reassured. Dr. McDonald, any thoughts on that, given your experience as a pediatrician?
Actually going to answer that with the next question, because the next question is really similar. It says, what are some effective tips or strategies when talking to those that are vaccine resistant to encourage them to get vaccinated, or at this point, should one not engage? So first point I make is always be respectful. 2, do not argue with people. because one, it doesn't help, and two, you're not going to persuade people at that point. What I do is I listen for the question, and then I answer whatever question I got. And then the next thing I do is I actually see if there's a different question. Because one of the things I found with my patients is if I let them talk, eventually I find out what their question is. And a lot of times the question takes time to come out of the room. And one of the things I've just noticed, if I take time and listen to my patient, I actually get to their question. And it's usually not that they're afraid of needles. It's usually not that they think it's a political thing for teenagers. It's usually they just don't understand why they need to get the vaccine. One of the things I explain to them is, well, you don't want to be sick, do you? No, I don't. You don't want to spread the disease to your mom or daddy or grandparents, do you? No, I don't. And I find for a lot of people that's persuasive because kids do pretty well with the vaccine, but kids do understand they spread the disease and don't want to spread it to their loved ones. The next question is, and this is for you, Dr. Chan, if we're headed towards regular boosters, what about people who are mixing and matching vaccines? Dr. Chan, what do you think about these mix and matching people here?
Yeah, so the CDC has and the FDA have all signed off on mixing and matching vaccines and that it's okay. And I also think it's okay with a caveat. I would say there's 3 different vaccines, as we know, the Pfizer, Moderna, Johnson & Johnson. We know that Johnson & Johnson has the highest, still a very rare risk of major side effects, but there are a couple, including clotting and Guillain-Barré syndrome. And so for folks that received the first Johnson & Johnson vaccine and want to get a booster shot, I do counsel my patients that they should get a mRNA vaccine as a booster shot. And there's the science now that shows that that actually leads to better immune response, antibody production than getting a second Johnson & Johnson. So that is one case where I do recommend to my patients at least that they get that. I say otherwise, if you got the Pfizer, Moderna, 2 doses, I would, my opinion, professional opinion would be just to get the 3rd booster dose of the same vaccine regimen that you got. I think that Pfizer and Moderna are both robust. They're fantastic. Yes, there's some data that suggests that Moderna may be a little bit more effective, but also keep in mind that the booster dose for the Moderna is a half dose. So in my opinion, there's probably marginal difference between getting mixing and matching the mRNA vaccines. I would definitely consider getting a mRNA vaccine after a Johnson & Johnson.
Yeah, I did the same thing. I had Moderna for dose 1, 2, and then got it for 3. Next question is, what is the likelihood you could be an asymptomatic carrier of COVID and be spreading the disease unknowingly if you're fully vaccinated? I think the answer to that is it's hard to say. It's less than if you're unvaccinated. I think the data is actually emerging on that right now. Most of what I see was based on the Provincetown outbreak in Barnstable County, Massachusetts over the summer. But I don't think I can give you good numbers on that. Right now, it kind of seems intuitive to me that the viral load of someone who's vaccinated would be less, therefore you would think they'd be less contagious, but that's why if anybody's positive, they should be still wearing a mask and isolating. I think it's important to do that. Next question, Dr. Chan, for you is, if everyone at a gathering is fully vaccinated, symptomatic, is it okay to remove their masks? What do you think, Dr. Chan?
Well, it's, I think as with everything, we're sort of still learning the risks and the benefits. And I think it sort of depends on a lot of factors. I, again, think about ventilation. I think the more room, the better. I think being in a bigger indoor space that's well ventilated, if everyone's vaccinated, asymptomatic, and it's not like everyone's, and there's some physical distancing, then I think that would probably be okay, in my opinion. I would also take into account the background rate. So we are still in a high setting, community burden, per the CDC, meaning over 100 cases per 100,000 last 7 days. So I think that's just important to know that we are still seeing significant COVID circulating in the community. So the answer is maybe, and fortunately, as with many things, it can be a little bit of a gray area, but it's risks and the benefits and, common sense. I think we need to think about some reasonable caution, but also, reasonable options in terms of opening up.
Next question is about vaccine breakthrough data. It says there's been postings from the health department on the number of vaccinated and unvaccinated that have gotten COVID. I think it's important to get the numbers of how many in each groups are hospitalized. So let me just put that, I have the link to that in the chat right now. And if you just click on that link, you can see the vaccine breakthrough data. So there you go. You have instant data right in front of you. You would have a place to find it again. Next question is, what are the high-risk jobs right now? Dr. Chan, what do you think are the high-risk jobs right now?
What are the high-risk jobs? Well, I think, I'm reassured that healthcare workers have been vaccinated. The high 90% now have been vaccinated, so that's certainly reassuring as you walk in healthcare settings. But I think healthcare settings are still high risk, partly because of the nature of the setting, obviously taking care of sick people, exposure to COVID, but also because I think in a lot of healthcare settings, there's so many vulnerable patients. So I think all healthcare settings, we just have to be more cognizant. One reason why there is a vaccine mandate is to protect people that are immunocompromised, vulnerable, older, for people in terms of who the vaccine would not mount an immune response. Otherwise, I think it's less about any specific occupation or setting. It's more about really indoor spaces with lots of people and poor ventilation. So that's what I think about. I mean, I eat at restaurants now, but I go inside, I go shopping. But I'm always very cognizant, and it's still at this time, while we're in a high zone of transmission, I do personally try to avoid larger indoor gatherings with poor ventilation. I think that, especially as we approach winter, that may be one thing for folks to consider as more of a higher risk setting, not just for COVID, of course, but for all the other bad stuff that we see, RSV, influenza, et cetera.
All right, we're down to the 2-minute warning, Dr. Chan, so we're going to go really quick for the next 5 or 6 questions. Next question for me is, do children spread COVID-19 the same rate as adults? I think the answer to that is probably. Quite frankly, at the beginning of the pandemic, that wasn't the case. With Delta COVID, the answer is it seems like they're more contagious. Probably not as much as adults, but it's getting close. The more data I'm seeing looks like kids are actually spreading COVID in household, in particular, in other settings as well. So certainly that's changed a little bit. Not terribly shocked about that. Next question, Dr. Chan, for you is, we're invited to a surprise party for a very dear friend. There could be up to 100 people in attendance. They have not asked for vaccine information and are not addressing the COVID question. We suspect there'll be several unvaccinated attendees. If it were you, would you go? Dr. Chan, are you going to a party like this? What do you think?
It's funny. This sounds like a board question. I just took my board exam. It's kind of giving you all the nitty gritty detail. The answer is it's up to you. I mean, again, it's a risk benefit. Depends how important this event is. Depends how big the space is, physical distancing. Of course, everything you outlined makes one nervous, but it's tough to make a gut call. I think at this point in the pandemic, we all know what the risks, what the benefits are.
All right, we'll do this last question. We won't get there, but we'll do this last one. I'll give you my thoughts on this. What do you think about the new COVID pills and their effectiveness? So molnupiravir is the one from Merck that is out there. Molnupiravir, it's said to be very effective. I have to see what's going to happen from the Food and Drug Administration. It's intriguing because it's one, 5-day course. It's expensive, but new things often are. I'm intrigued by it. We'll have to wait and see. Dr. Chan, you're the infectious disease expert. What are your thoughts about molnupiravir?
I think it's very exciting. I think it's what we've been waiting for, if I were honest, a pill that can treat COVID. I think it's a dream. And I'm also reassured that Merck has stepped up and is licensing it to other companies throughout the world so that other more resource limited countries have access to this medication. I think it's a huge advancement.
Okay.
Janaya, why don't we bring it back to you? Thank you so much, Janaya.
Yeah, thank you, Jim, for fielding it. How do I sound now? Is that a little bit better?
Oh, your sound's awesome. You're like DJ quality right now.
Finally. Well, I'll bring it home. Thank you, everybody, or rather, thank you, doctors, for answering our questions and for being so informative. And I'm going to bring in the director of Providence Public Library, Jack Martin, to wrap it up. I am not actually a DJ, but Jack is. So get ready, everyone.
I'm a DJ on occasion. Thank you so much, Janaya, and thank you so much, Dr. McDonald and Dr. Chan. That was a really incredible conversation, and I learned so much. And I know that everybody else did too. I just wanted to thank the Conservator Society for all that they do for the library. We would actually not exist without you. At least we are between 80 and 85% privately funded at the Providence Public Library. So every donation counts. So thanks again to the Conservator Society. Thanks again to all of our donors at the Providence Public Library. And if you would like to learn more about joining the Conservator Society or giving to the library, Alex Rimpus, our Major Gifts Officer, is on this call. He would be happy to talk to you. I would be happy to talk to you too, as well as Erica Basila Adams or any member of the Team X group. So thank you all again. Like I said, I thoroughly learned quite a lot during this conversation, and I can't thank the doctors enough. And Dr. Chan, if you have not read the Rivers of London series yet, I totally recommend it. And Dr. McDonald, I have other sci-fi recommendations for you too, if you're curious. I was hoping to have a feline join me on this closer, but unfortunately they have flown the coop. But once again, thank you to everybody, and let's carry on.
Have a good night.
Thanks, everybody. Have a great night.
Thank you all.